So at this point, COVID-19 has extended its reach to every state in the United States and has affected nearly everyone's day-to-day lives within our country. Now, the US isn't the first country to be hit with the coronavirus and is not the first country to be affected severely. So let's actually examine three other countries, specifically South Korea, China, and Italy, to see how they are currently faring against the virus and how each country reacted in the past and what measures they took to lead them to this position that they are currently in. So let's first look at China. They were actually the first to be affected by the coronavirus outbreak. They were the first to have been significantly affected by it as well. In fact, for a majority of the time, 90% of the world's active cases of coronavirus were concentrated in China. However, now this is no longer the case. In fact, we can actually see now that China has, in fact, gone past their peak number of cases, and each day, the number of active cases in the country is actually dropping. Now, there are some reports that China's drop may actually be caused by a reduction in testing, but we're going to be putting that aside for now. So just examining what China has done, they were a bit slow in comparison to other countries to initially act on this outbreak. However, this can primarily be attributed to the fact that the virus was still very new when China was facing it. They were the very first country to be affected by this outbreak, and thus we cannot simply put too much blame on them for actually acting a tad slower than what other countries have when other countries first receive it. However, since China actually first had the outbreak and were first affected by the outbreak, they put tight lockdowns on various regions in large metropolitan cities. And over time, this caused the number of cases and the spread of the virus to stop. And in about 2 months of such lockdowns, China is actually witnessing significant drops in their coronavirus cases, and businesses and regular daytime life is actually getting ready to resume. So in terms of what the US can learn from China, locking down cities and people staying home works. It slows the spread of the virus enough so that the cases continue to drop over time, and this can in fact reduce the spread of the virus as less people have it. Now let's move on to Italy. Italy is actually the only country that currently has more active cases of the coronavirus than the United States, and their death rate has been alarmingly high as well. This is largely due to the fact that, as we have discussed in the past, they were unable to flatten the curve and are at a point where the number of people who need care with the virus is more than what the hospitals can offer and can actually handle. This means that they are actually having to reject potential patients because there's simply not enough available beds and space for potential patients. And this is a great example of what can happen when the curve is not able to be flattened. And that's why, needless to say, the situation in Italy is actually quite grim and the number of deaths is actually quite high. Now, there is some slight light in the situation in Italy in that the increase in active cases per day is actually dropping over the past 2 days. Now, attempting not to confuse anyone with that sentence, that purely means that if there was an increase in 700 active cases 2 days ago and 600 new active cases yesterday and 500 new active cases today, that's the drop in the increase in a number of active cases that I'm trying to indicate. So the number of active cases is still growing, but that growth rate is sort of slowing down. So Italy has yet to reach its peak number of active cases. So they are making progress towards slowing the extremely rapid spread of the virus, at least slightly, but they still have more in front of them, and I think that's pretty evident just by their graph. So in terms of what the U.S. can learn from Italy, mainly act quickly and make sure we flatten the curve now so we can reduce the number of deaths as much as possible. In order to do this, it is the responsibility of every citizen, now more than ever, to conduct good practices, social distancing, self-quarantining if sick, and only going out when it is necessary is extremely important at this moment in time for every person in the United States. So now let's head over to South Korea and exactly how they're handling the COVID-19 situation. Looking at their numbers, they have actually passed their peak and are on the path of reducing the number of active cases day by day. This means that as each day passes, the number of people currently infected with the coronavirus in South Korea actually decreases. In fact, South Korea was actually able to go from the original 100 cases in the country to their peak number of active cases in just 3 weeks, meaning that they were able to stop the spread of the virus from 100 cases in just around 20 days. In comparison, China took nearly 3 months to go from 100 cases to their peak number of active cases, and Italy logged 100 cases just 1 month ago and still are not quite close to their peak number of active cases. And this is especially incredible when you consider the close proximity of South Korea to China and how easily the virus could have transmitted between those two countries with the great number of transport between the two countries. So now, what exactly is South Korea's secret? Clearly, they handled this situation a lot better than many other countries and have handled it much quicker as well. In fact, they haven't put massive amounts of lockdown throughout their country either. So what exactly is South Korea doing that is different from what other countries and other regions are doing? The answer? Testing. Lots of it. They have had a great infrastructure for medical testing built up from the H1N1 outbreak and the swine flu outbreak, and were able to handle the situation very effectively, efficiently, and with minimal losses in life, money, businesses, and economy. The US can definitely take away from South Korea that testing is essential. The government and authorities need to be putting out more testing kits, and more drive-through testing centers should be opened up, allowing more citizens to get tested. This serves a lot of purposes, ranging from initially limiting the spread from those who are infected to getting a better total of how many are actually infected, which allows the country to respond better. In summary, from these countries, Italy, China, and South Korea, we here in the United States can take away three main things. First, locking down areas such as schools, regular store, businesses at this time is essential. Make sure that people are only leaving their house when necessary and are maintaining strict quarantine if they are sick. Second, make sure that we as citizens are taking it upon ourselves to increase our personal responsibility of conducting good practices at this time. I've stressed this a lot, but I will stress it again. Make sure you are social distancing as much as possible. Stay 6 feet away from people at all times if possible, and don't leave the house unless it is absolutely necessary. And finally, third, testing. If you're having symptoms, go get tested. However, the contrary is also true. If you're not having symptoms and are simply just frightened of the situations, the chances are that you don't actually have COVID-19. Testing is limited, is actually very limited right now within the United States, so don't get tested unless you are experiencing some symptoms or have traveled to an area, a specific area where the COVID outbreak is very rampant. Now, however, this also goes for authorities and the government. Increase the number of testing kits available so that we can test more people for the virus. It is impeccable that we do this. If we, as the US, are able to successfully learn from other countries' experience with the coronavirus and use those lessons effectively, we can more quickly reduce the vast damage of the virus and limit the spread of it, along with the number of who, unfortunately, lose their life to this deadly virus. It eventually comes back to us as citizens to make sure that we do our part as well as the government does its part, and go hand in hand in order to limit the spread of this virus and limit the number of people who lose their life.